7 on Your Side investigates cancer concerns in a Long Island community. A newly issued report by the state of New York confirming what one community has known for decades, that cancer plagues their community. A study by the New York State Department of Health has determined that the Northport School District has, quote, statistically significant elevations of various cancers. Since 2017, we've reported extensively on the concerns.
So what does this study mean for the Northport community? Here's 7 on Your Side investigative reporter Kristen Thorne.
We zoomed with former Northport resident Tara Mackey from North Carolina. That's where she lives now after moving her family 3 years ago.
Do I continue to fight for other people, or do I just pack up and get out of here?
And you're leaving.
I'm probably going to have to.
And it was the hardest thing I ever did, but I had to do it.
Mackey says 3 other Northport families did the same thing over concerns for the health of their children at Northport Middle School, where environmental toxins were later found, forcing the school to close temporarily. For 5 years, Eyewitness News has been tracking health concerns within the East Northport School District, which culminated in a 20-year cancer study by the New York State Department of Health. The recently released study found that the number of people with cancer living within the entire school district is statistically significant, especially for pancreatic, uterine, and prostate cancer. They said the cancer rate was especially high for those living in the Northport Middle School District. They said most of the young adults with lymphomas lived around the middle school.
That indicates that there is a problem, and some of the things that I and other concerned community members have been saying are in fact true.
The department said they found some cancers in the community were lower than expected, like for stomach and lung cancer. They said they have no explanation for why 7 members of the Northport High School class of 2016 were diagnosed with leukemia. Statistically, they say it should only be 2.
I asked the State Department of Health if they plan on doing any more studies of the district. They would not answer that question. They only said that it's normal in a large community like this for there to be cancers that are high, others that are low, and that these cancers have not been conclusively linked to environmental factors.
The department says it does not believe the community should be alarmed by the study results. The superintendent of the school district said in a statement to Eyewitness News, "I care deeply about the health and safety of our students and community. At this time, the Department of Health has not directed us, the district, or the community to do anything differently or make any changes based on their findings." But Mackey and others are still pursuing a class action lawsuit against the district for negligence.
If your own study tells you that there are statistically significant higher results, then you can't say that, it's meaningless.